just do it there. Okay.
Okay. All right, guys. Thanks for all logging on. My name is Heather Schultz. I'm the outreach coordinator for the Down Syndrome Partnership of North Texas. This is part of our Speak series, and we are doing a special Speak in summer because we are having a lot of conversation online about what we're going to do with school with all of our kids being on an IEP and not a lot of guidance coming out from the schools. So we asked Dr. Marilyn Tolbert, who is the former director of the Kinderfrog School at TCU, and she has a ton of information. She knows everything, I feel like about special education in our area. So we asked her to present information to you guys, so we hope you find it helpful, and we're going to go ahead and let her present. I know that we're going to have a lot of questions, especially with information that came out today, so if y'all just save those to the end and then she can answer them for you. So if you want to go ahead.
Okay. Hi everyone, welcome. Can you hear me okay? Can everybody hear me? So the topic that Heather gave me was education rise in a pandemic. What I had a whole different slideshow prepared for you about, okay, here's some things you need to think about as we're starting to go face-to-face. But then as of today, of course, that's all changed. So I told Heather we could have another speak session in September, and I'll have that. I have that one already, so I had to kind of regroup today, which is fine. That happens. But anyway, what I've done is just put a few slides together because I assumed this was going to be more of a conversation and a Q&A, but I do have several resources for you that I'm going to provide, so you can, get on the web and look at all the different things that are there. So I'll just start with, if I can get it to advance. Okay, so as I said a while ago, and as Heather intimated, one thing is certain: the landscape is changing continuously. And it's in some points, at some days, it's hourly. We were preparing at our school district for a hybrid of remote and virtual, and then we're told yesterday that there would be an announcement today, which of course it came. And I'm sure you all know this now. So as of noon today, there's the local health authorities and the cities, the county of Tarrant and city of Arlington and city of Burleson, regarding public and non-religious private schools cannot reopen until September 28th. And there are a few exceptions, and there is a court order out, and there are a few exceptions. It does talk about special education. It talks about religious schools, so they can still be open if they want. There's several different exceptions, but it's really, it doesn't really apply to most of us because, and Kinderfrogs might be an exception. They're looking at that very closely, but they haven't made that determination either. So just a couple of things just to start us off, to receiving special education services. So when schools are closed, the local education agency, which is your school board, they have to make sure that they, when the schools are closed, that each student with a disability can be provided the special education and related services identified in their IEP. So they have to do that if the schools are closed and only offering virtual. Now, if they're completely closed, meaning that no one's getting instruction, of course, you know that, then your children would not be eligible for any services as well. But from what I've understood from a lot of people and on the web, a lot of people were not getting what they were supposed to be getting from March to May. So you should have been getting the related services and the special education services. So we're going to talk about that in a minute. I want you to know that like this emergency for COVID-19, if the school is providing instruction, as I said, but is not able to provide services to a student with a disability, then there must be an ARD committee that determines which services can be provided appropriately to meet the student's needs. And as soon as the school reopens, that ARD committee needs to convene and determine whether and to what extent compensatory services are needed. And we'll talk about compensatory services in a minute. And then, of course, the federal law is students with disabilities have an equal opportunity to participate in the virtual model of delivery. As long as the school is in session in some form or fashion, so virtual or in person or a hybrid, the full individual evaluations and eligibilities, the IEP, the placement decisions, and the ARD committee timelines are all still in effect. So they don't get a free pass for, you know, the 30 or the 45 days or the 10 days. They don't get a free pass for any of those. If school is open, then they need to still meet those timelines, and that's a federal law, and if they're not doing that, they're out of compliance. So I want to talk to you just for a second about compensatory services. So this would be for a student that could not access remote education for a variety of reasons, but a few are students and families who had cognitive, behavioral, language, or technological barriers to accessing their education. They weren't able to access their education because the district didn't implement their IEP, or they didn't implement related services such as occupational therapy or physical therapy or speech therapy. Now people are saying, well, I don't know, I didn't get that done. Well, then as soon as school starts, once school is able to come back on face-to-face, there needs to be a meeting with the school so that you can see if your child lost ground, you know. And if the schools don't like this terminology, compensatory services, because they feel like that is, oh my gosh, they're getting ready to sue us, which you could. But the solution is really for you to agree to remedial services. So I want to make sure, let's say that, you know, your child was reading on a second grade level, and because he or she's been out of school for 6 months, and you can't get them to do as much as they would, or maybe they've either really done well, or they're like, no, mom or dad, no, don't need your help. I don't want to help. Don't want to do it. And all of a sudden they're back to a pre-primer level or a primer level or even a first grade level. Then you need to talk to them about what are they going to do to help remediate and bring that child back up to speed. Does that make sense? The other thing that you need to know is that federal law does not mandate, unfortunately, specific methodologies for virtual instruction. So it can be provided a variety of ways. It can be through distance instruction, through the computer, teletherapy, through iPads or Facebooks, teleinterventions. That's also through Facebook or iPads, meetings on digital platforms, but it also can include low-tech strategies. So they can provide an instructional packet. They can provide a project for them to complete. They can pretty much do whatever they want. It doesn't have to be a specific methodology, unfortunately, when it's virtual instruction. So I'm giving you, and make sure that Heather has this PowerPoint, because I want you to, and I've given you the information at the top, how to log in. But if you see on Q&A on COVID-19 and Down syndrome, and this is about a 14-page report, and it's done by all the big Down syndrome organizations, NDSS, NDSC, LUMIND, Global, the Down Syndrome Medical Interest Group, and several other supporting agencies. And they've all collaborated and worked on information about Down syndrome and COVID-19 and how it's going to affect you. And it does talk about the risk factors. It does talk about, things to look for. So I would really encourage you to, in your spare time, to pull that up. It's globaldownsyndrome.org, and then you'll see it right on the front page, Q&A, and that's just a piece of what it looks like. It's very, very informative. I'm not going to read it to you, but I did pull it, and in case you had questions, and I can provide them for you. The other piece is TEA, and they have a whole big section on COVID-19 support for special education, several FAQs and frequently asked questions. They have several different suggested platforms, but of course TEA has been giving us mixed messages all since March. So this is ever changing. In fact, I tried to upload the July 17th newest information, and it was the page was not operating. So they are updating continuously. And the Commissioner of Education, Mike Morath, there's a video, but he maintains that school needs to be open. And some counties are going to be opening, but not Tarrant at this point. So tea.texas.gov, and then there's a section for special ed, so you can go there and you'll see that as well. And then there's a whole different piece of all kinds of information from the U.S. Department of Education. And there's a frequently asked questions and responses there as well. And you'll see even just with that screenshot, there's fact sheets and a lot of different information that is available to you. It's pretty much redundant of the things that I'm talking to you about, but it's there for you if you want to remember. And then this is the OSER. This is from the American Bar Association, but it's really through OSERS. And this is the Office of Special Education Programs, and it gives you a lot of different OSIP questions and answers. And they are a very good resource if you're having a specific issue. Even though they are federal, they are not state, and state, trumps feds really for local policies. But they are a really good resource if you need specific information about something. And they have a customer service, so to speak, contact. You can email them, and they're really pretty good about. I don't know how good they are right now with all the, because I'm sure they're getting a volume of people, but they are. Oh, sorry, I've got to let people in. But they've got a lot of information, and they are very responsive, and they will give you a lot of good information. So if you have questions, they're very good, very responsive. Okay, why did it stop? Okay, then I also wanted you to know about, whoops. This is going to happen next Tuesday night. Well, it's Tuesday afternoon at noon. It'd be noon Central. There's a registration there to go to webinar. And this is a new, this is something that we, the NDSC, we've put together. We're working with, we're working with 2 lawyers and Heather Sachs, which is our policy and advocacy director, and the Feinstein Education Law Group. And we have, we're working with them on back to school or not and understanding your options. Because one of the things that's happening is some of the school districts are saying, well, you could just homeschool. Why don't you just homeschool? Or parents are saying, well, I'm just going to homeschool. Pull my kid, I'm going to homeschool. And I want you to proceed with caution on that, because if you literally withdraw your child and go to homeschool, then you're basically giving up all your rights to your child's FAPE. And what will happen is if you decide to re-enroll them in school, then they have to go through all the testing again, all the eligibility again. I mean, it's really just, it's silly. So even if you are homeschooling, I would encourage you to not tell the schools you're homeschooling. And I probably shouldn't say that because it's being recorded. But anyway, you really have to be careful about home instruction. Now, homeschooling. Now, homebound or home instruction, because your child is medically compromised, medically fragile, you don't feel comfortable with him returning to school, that's a whole different ball game. But just be really careful about the legal implications of different schooling options. But this particular webinar, and it'll be 1 hour, it's at noon next Tuesday. And I really, if you can, take advantage of it. And I think they're going to record it. So if you aren't available to get it then, I would really encourage you to get that information. And I use some of their information that they're actually presenting for this particular presentation. But this one will be very, very involved. And it'll be based on federal law, the things that I've kind of already talked about. But it's always good to have additional information and some additional responses, and they'll have some other things that they will talk about. So if you have time and you can manage that, register for that. It's free. You just have to register in the GoToWebinar registrations right there at the bottom. Okay. So there's many considerations when schools reopen face-to-face. I don't need to go into them now because right now you're worried about virtual instruction and what's that going to look like and how's that going to work. But as I said, I will be happy if they would like me to, or I can provide the PowerPoint to them of things that you need to consider face-to-face. I mean, one of the big ones is, how are they going to maintain social distancing? Are they going to require masks? But even more than that, what happens when someone in the school is diagnosed with COVID? It's going to happen, and there needs to be a lot of protocols. And some school districts are working very hard on that and being very thorough, and others are not. So that's going to be a big piece because, and so many of our children and young adults are asymptomatic. So, can be super spreaders, as Fauci has said. So we have to be really careful, but I'm not going to spend any time on that because I know you have other questions about that. But we can talk about that right before September 28th, when they can come back to count. So those are the basic things I wanted to talk to you about. But I really want to open it up to Q&A, concerns. What can I can try to answer.
Hi, Marilyn. How you doing? This is Liliana.
Hi, Liliana. How are you?
I'm doing good. Thank you. Thank you for doing this. I have a question. Leo I know this may apply in the future, but that's a concern that I have. So Leo is going to be third grade. He spends 40%, or used to spend 40% of his time in FOSI and 60% in inclusion in 2 different classrooms. So I'm guessing during the COVID, or maybe even after that, he's totally losing that inclusion, right? So yeah, I'm guessing that, because how can they manage him first being in his special classroom and then handling him to go to 2 different classrooms for inclusion, on the social distance? So what would happen after that? Right now I'm kind of guessing that's going to be the scenario. And then,
so his IEP says 60% inclusion.
Yes.
Then that's what they have to follow, unless y'all come to committee and change that.
Okay, but even if he goes back to school during when let's say in September, they open up, they said, okay, yes, he can come back. So they will have to be super extra duper careful for him to be in 3 different classrooms, right?
Yes.
Okay.
They will have to have a procedure for that. So they'll probably have him a certain, all the kids will probably have it. Probably won't be like when I taught, I always had flexible seating and kids could sit wherever they wanted and shared supplies. They're not going to be able to do any of those things right now. Everybody will have their own things, their own desk, or their own, and some schools are looking at protective plexiglass protection around them. I mean, it's pretty crazy, but they're going to have to do that initially, unless in September, God willing, we, the spread, the curve starts to flatten again. And if that happens and people are, abiding by wearing a mask and trying to social distance and all those things, then hopefully, things will be better. But if things are exactly like they are now, if things are exactly like they are now, they won't open.
Okay.
They probably won't open.
Yeah.
But hopefully things are not going to be like they are now. Hopefully they're going to be better. And then, but there will still have to be precautions until that curve is way low.
Okay.
So they're going to take, I mean, like for our district, they're going to be taking temperatures. They're going to, randomly throughout the day, they're going to be, parents have to say, yes, they don't have COVID symptoms. I mean, there's a ton of protocols. It's really going to be, but yes, if his IEP, unless y'all went back to committee and when school starts back open, 2 things would need to happen. They would need to change that, where the inclusion was not happening. They would have to agree that inclusion would not be a good thing, which I can't imagine that would be the case, but they might try that. And then the other piece is, how is he doing academically and socially and emotionally? And what do we need to do? And what do we need to do to help put him back where he was if he's, you know, having trouble with any of those issues.
Okay.
Yeah,
Yeah.
don't let them snow you.
No, okay, thank you. Yeah, actually, I'm having a virtual meeting with the evaluator next week to talk about his plan. Okay.
Okay. Yeah.
Okay.
Yeah. They have
Thank
to.
you. Yeah.
They have to follow the IEP as
Okay.
written currently, unless they have another meeting, and then
Okay.
as an ARD committee. But remember, you're part of that ARD committee, and they cannot use the pandemic as an excuse.
Okay. Yeah, my only concern would be kind of the regression he's having sensory-wise
Okay.
to loud noises,
Yeah.
but I guess that I need to address that with them. Yeah.
Right. Well, and I would talk to them about that and say, we're seeing that regression. So we're going to need to, when he gets back, we're going to need to remediate. And I mean, you know, you're entitled to call an ARD even during this time and talk about those sensory issues and see if they can come up with some things that they can do, you know, to, by providing you materials or to deal with those sensory issues, or by doing something teleconferencely with him. You know, there are things, I mean, I'm not, you know, I'm a school board member, so I'm also trying to make sure, because the teachers are going to be overwhelmed. They're overwhelmed already. They're freaked out. Oh my gosh, we were planning for face-to-face and now we're not. And what are we going to do? And how are we going to meet the kids' needs? I mean, everybody's in the same boat. None of us want it this way. It's awful.
No.
But
okay, thank you.
You're welcome. What else?
I have a question.
So Luke has his full evaluation is due at the end of August.
Yes.
And his full evaluation. So originally it was scheduled for a week after spring break, and then they said let's wait and do it in August when we can come back to the school building, because the PT and OT say, well, we can't do an evaluation without physically seeing him. So from what you said, they still have to follow that. So what's going to happen? Are they going to have to let him meet with him in a building? Are they going to have to do it over Zoom? Like, what's going to happen with his evaluation?
Well, so for his FIE, if the district is saying that they cannot physically meet him one-on-one and evaluate, is that what they're saying?
Well, that's what they said back in April, because they were assuming that that in August we would be back in school and they would be able to do it that last week of August when we were in school. So since today happened and they're not opening the schools, my question is, what now? Are they going to have to meet with him?
Okay. Okay, so I'm going to tell you, this is an exception for the order, and I'm just pulling it so I can read it exactly. So administrators, teachers, and staff may conduct or facilitate virtual or remote learning processes while on campus, following the existing guidance for social distancing and facial coverings. Special education instruction may occur when necessary and in accordance with TEA guidelines, as long as and when feasible, facial coverings are covered, blah, 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 social distancing. Students whose individual education plans cannot be implemented with remote learning or who have limited household connectivity may be provided in-person instruction with social distancing and facial coverings. So I would take the stand, if I were you, I would say, if you maintain if he wears a mask, you wear a mask, and they maintain social distancing, they should be able to evaluate him so that you can get that FIE completed.
Okay, originally they said they can't do it without seeing him, but now what if they change their mind and say, well, can we do an evaluation over Zoom? Should I allow that?
For OT?
Yeah, I don't know. I mean, they didn't want to, but I don't know if they'll change their mind now. So.
Okay, so let me ask you this, and I know he's different from everybody else, but didn't Sodi do a final OT eval?
Yes, but they don't want to use, I wondered about that too, if they could just use the information that I have from.
If they're not willing,
originally, they wanted to do their own.
They always want to, but if they aren't willing to do that, then they need to accept the one you have.
Okay.
Does that make sense?
Yes.
If they're not going to do it, if they're saying they can't do it, then guess what? Then they need to accept the one you have. But honestly, I don't see why they couldn't. If they maintain social distancing, then they could take Sodi's information and look at it and then assess from there, then they should be able to get what they need to get done. I mean, that, and you haven't talked to them yet, right?
I have not. Like I said, our last, the last conversation was in May, was that we will do his PT and OT evaluation in August when school starts back. So,
Okay.
After what we heard today, I'm gonna, contact the diagnostician and see what their new plan is. I just wanted to be prepared going in. I have no idea what they'll say, but
Yeah, well, let me know, because if you, they need to, either you have something from a licensed occupational therapist, and if they're not willing to work with you one-on-one, they may say, well, we don't, but it does say that they can go in for some instruction if needed. It does, that order is there. So I would say that an evaluation piece would be part of that. What else?
Marilyn, I have a question about,
buddy.
hi, I have a question regarding our district is going to be doing, and I don't think every district's doing the same thing, but they explained that it'll be asynchronous learning, which means that it's not real-time live instruction, right, virtually. And so my question is, can we request that for our kids that they do get that one-on-one instruction with their teachers, even if it's just for an hour a day? Because right now, the way it stands, and I know that they'll make exceptions because it is special education, but right now the way it stands is that each teacher in our district will actually have the opportunity to schedule their own morning sessions if they want to, but because of attendance and the way that the district gets funded, our superintendent is explaining that we are choosing asynchronous as a district, which just means that just by the end of the day, you have to have your assignment turned in, or you have to check in at some point, and it's going to look different, I think, for each grade. But anyways, that being said, what should we be asking for? Because in my mind, I can't imagine that not receiving any type of direct one-on-one, even virtually, is going to work. I mean,
Okay, so is that as of today?
no, this came out last week. This is ahead of the game. However, I'm privy to some other conversations with the school board, and I do know that I think they're still moving forward with that.
Heidi, what school district are you in?
It's Grapevine, Colleyville.
Okay, well, the federal law says, because it is up to the local education agency, it is up to the school board and the school district on how they deliver that. And it can be any virtual, it can be any methodology. The feds say it can be any methodology. Now, if you have a strong group of parents, which I think you do, I would push for, and you're probably going to have to meet with the school, you're going to have to meet with the superintendent, and you're going to have to meet with the school board. But I can't imagine, that the school board would not hear you. I mean, luckily, Eagle Mountain has somebody that's in special ed that's on the school board, so it looks going to look a little different. But but we've had those discussions as well. So the special ed, I mean, you probably are going to need to, because there's nothing in the law that says they have to do it direct instruction. There's nothing in the law that says that.
Okay, and actually their information they publicized and put out last week did actually say, and it's one of the top priorities, which I'm happy about, that special education will be considered differently.
Okay.
I'm just trying to figure out what we're supposed to be asking for. I don't know what's unrealistic from a teacher perspective, even just because, I mean, I don't know if they're in the building, are they working from home, or how that's, you know what I mean?
Well, yeah, again, that's going to depend, because depending on the school district, the school board and the district is going to decide, do the teachers have to report to the school building every day? or do they work from home? Because that's going to look, just because the remote, just because it's virtual instruction doesn't mean that the staff is at home. It's not like it was in March. Does that make sense?
Yes. Totally.
So that's going to look, that's going to look different from district to district. And I'm not privy to all the districts. I haven't really, I mean, and I think everybody's scrambling right now because everybody has plans in place. And then now, you know, because we were going to do both based on our surveys to our parents and families. So now we're having to regroup, and as all are the other districts. So I would say that, you know, while they can do pretty much whatever they want methodology wise, as parents, I would go and strongly ask for what you think you want. You know, do you want your kids to go to school? Because the order says, if I'm going to pull it again and read it to you exactly. Whoops, what did I do with it? The order is very specific. Special education instruction may occur when necessary and in accordance with TEA guidelines, so long as and when feasible, facial coverings are worn and social distancing of 6 feet are followed. So it does say, it says school systems shall not reopen until except for special education instruction. So theoretically, you know, now a lot of our families don't want the children to go to school because they are. I mean, you know, I'm not gonna sit here and tell you should send your kid to school, because they are compromised. They are at higher risk. I mean, the Q&A from all the national organizations and the Down Syndrome Medical Interest Group, it says in no uncertain terms, if your child's had a heart condition, if your child has breathing issues, if your child, I mean, there's a long list. And our kids are very immune suppressed. So, you know, that's going to be an individual decision. Every parent's going to have to figure that out themselves on what they think, or what they, you know, are they willing to take the risk. Like I said, my biggest thing is face-to-face, what's going to happen, because it will happen unless the curve is zero. Somebody's going to be exposed. And so then what happens?
I listened to a SPED attorney on Saturday talk about technically, when you do virtual instruction, it is a change in placement, quote unquote.
Yes.
And so it does bring up some questions, because I'm actually sitting here thinking, so how are we going to, because I know for a fact, just watching what happened over the spring, there's no evaluation happening because there's no one but myself. I mean, technically. So what I'm trying to figure out is, should we be asking those questions to our committee, as how are we going to address maybe goals being met and evaluated? Because I have I can't even imagine what they're going to be doing.
Right. Yeah, they're going to need to be looking at all the IEPs. They're going to be making sure. I mean, some of the schools, like, kids weren't even getting any therapies. And they should have been. They should have been getting some therapy through teleconferencing. Period. I mean, you know, it's in part of their IEP. They're out of compliance. Now, again, in March, April, May, you know, the commissioner, TEA commissioner, he was much more forgiving, as was the districts, because everybody, I mean, none of us was, you know, everybody went off on spring break and thought they were going to come back and everything was going to be fabulous. And guess what? I mean, nobody left their classrooms thinking they wouldn't return until September, you know? So, but now it's going to be different, because they've had the time to plan. They've had, and Morath, who's the commissioner, has spoken in no uncertain terms about, am I getting, because I hear muted, am I that me? In no uncertain terms, he's asked to, that assessment has to be a big piece, you know. Now, whether it's going to be STAR or not, I don't know. I mean, you know, there's a big question about that as well, or STAR alt and all those things. I mean, like I said, TEA keeps flipping things. The governor keeps flipping things. I mean, everybody keeps, it's all unknown at this point. But that's why it's going to be really important for you guys to be in tune with your district administration, and if you've got concerns, you need to speak up and let your school board know, because they'll be listening, and that's, you know, we work for you guys. You know what I mean? We work for you guys.
I guess I have a question, Marilyn. I know that, like Heidi just mentioned, so many of the school districts had already made these decisions and made these announcements on this decision. And then, of course, the health department comes in today and trumps all that. Is there somebody that can come in and trump the decision they made today? I mean, are we expecting more changes, or is this pretty much it?
Yeah, we're not expecting any more changes. Yeah, they were on. I was not on the call, but our superintendent and our board president was on the call for over an hour, about a 3-hour call yesterday. So there was a lot of discussion and a lot of, you know, pros and cons and what should we do, and you know, because the numbers, the COVID numbers are not decreasing. Although today I saw that Dallas had they had under 1,000 today, finally, for the, you know, first time in a month. So, you know, I think if we see the numbers go down, I don't think there'll be anything changed now. You know, like I said, Morath said just last week, but I think but it is ultimately up to the local schools and the local agencies. You know, it comes, you know, the Fed's an overarching piece, and then there's the state, but really the power lies in the local districts. And so, you know, as far as what happens in your district and what goes on in your district, I mean, there are federal laws and there are state laws, of course, but, you know, the policies and procedures, basic policies and procedures are individual. And that's why it's so hard, because every district is a little different, and everybody's doing things a little different, and everybody's, you know, so the things that I talked about, like remedial services and compensatory services, and, you know, your FIE and ARD committee guidelines and all, those are federal laws. They can't get around those. There's no way they can get around those. They have to follow those, or they're out of compliance. And, you know, Texas is under, if you go on the TEA website, you're going to see that we are under scrutiny right now. I mean, Morath received a letter that says, this special ed department, the special ed in Texas needs a lot of work. We need improvement. So he's under the gun. So in some ways, I think that will be helpful to us. We won't get slighted. We won't get buried in the sand, so to speak. But at the same time, teachers are going to be really, they're overwhelmed. They're already overwhelmed, because they're like, what do we do now? And now we're having to regroup. And so I would never say never that somebody couldn't trump Kim, but I don't think, I mean, you know, it's really it's a county by county decision. And I mean, somebody asked me today, what about Aledo? I said, I don't know, they're Parker County. So they fall under a completely different, you know, that's going to be up to them. Hood County, Granbury, Hood County. I mean, I don't know, because it is county by county. So this is county, Tarrant County, City of Arlington, City of Burleson. So, you know, and Burleson did that because, you know, there's outlying things that are probably not Tarrant County and Burleson. Technically, they're probably right on the line. And so, but those are the three, and the health department. But Aledo, Hood County, Parker County, Cleburne, which is, I can't remember what county they are. They might be Hood too. Anyway, I mean, those are all, I haven't seen any formal announcements about those. And then people are asking me about colleges, and those are all up in the air too. I mean, you know, TCU is maintaining that they're going to stay open, but, you know, once these guidelines hit today, I don't know if they're reevaluating or not. You know, my guess would be they are looking at it at least, you know, so it's a mess. It's just a mess.
Carolyn, I have a question for you. I have a junior high student, and our situation here is a little bit different. So I opted for her to do homeschool for the semester, rather than going back to school. And when we were out from March to May, it was provided by the state. The assignments were, and so it's like, oh, let's go look for leaves, let's watch a show, just kind of engagement. rather than instructions. And with her being fully included and returning back, our current plan is she will log in during her class period time with her peers. So my house setting will need to just look different, and then just her being able to sit through her 5 core classes a day. Do you have any specific recommendations? I mean, like I've purchased flexible seating. I've purchased lockers for the house now, because it's not like, okay, we're just doing engagement. You're actually sitting in there, and the aide that is with her will have her computer to walk around with her. But I just want to be sure at home that I'm not overwhelming her with sitting for at least 5 hours listening to classroom instructions compared to being at school and moving around.
Yeah. No, none of us can sit for 5 hours, can we? That would drive me crazy. So I would just, she's going to need frequent breaks. I mean, I would look at her accommodations that she has in her IEP, and make sure that she, that your aide is following a lot of those, chunking the material, breaking it up in small, checking for understanding, taking frequent breaks. I mean, doing all those things. And I mean, even with a break, she can incorporate some learning with it if they're, getting up and taking a walk or whatever. I mean, she could be talking about the content that they just, reteach, so to speak, I would do those kind of things. There's also on the TEA website, as well as the education.gov, there are some really good resources about teaching remotely, and there's a lot of good information for parents. So like I said, I downloaded this much yesterday, really this morning when I saw that we were going to change gears, and this is nothing. I mean, I could have done paper. I mean, there were so many articles and so many different things. So they really are, I think they really are trying, TEA, Office of Special Education, Special Educational Programs, and the Office of Civil Rights. Everybody's working as fast as they can to put things together. Also the Education Service Center. So Education Service Center Region 11, they also have some resources as well. I did not pull those because their website was not as user friendly. So just to take a screenshot of that to show you. But ESC 11 is another good resource that you might look at, just depending on what you're looking for. But there's a lot of stuff out there, a lot of stuff. Ruth, I see you speaking, but I don't hear you.
Ruth, are you on mute?
Doesn't say she is.
Can you type your question?
I'm gonna type it in the chat.
Yeah.
Yeah. I'll be back.
There you are.
We hear you now.
Whoops.
Oh, yeah?
Yeah.
Oh, okay. Okay, that's good. So we are part of the King ISD, which is part of Johnson County. And as of yesterday, school starts on August 4. And we had the choice to select whether we want to bring the kids to school or whether we do virtual. So we initially decided to do online with Isabel, because when I asked about going back to school, they said that she will not be able to go to inclusion classes because they are not going to let the kids go around, like go to other classes. So pretty much the way they are deciding is that there's going to be groups. And so third grade is going to be with a third grade teacher, and art and everything else is going to stay in that classroom with that group and with that teacher. And so I didn't want Isabel to stay the whole day in the special ed classroom.
Right.
And so we decided to do virtual, and we'll still be able to go to school and get and receive speech and OT.
Okay.
And they have talked about having an art meeting at the beginning of the year or before the school year. And I don't know if one of the reasons is because we need to change that. They want to change that inclusion section
Yes, that's exactly
in
it.
the
Yes.
IEP. Just now listening to the conversation, that's what I'm starting to think that's what it is. And I don't know how reasonable or how much they are going to listen to me if that is already a decision that has been made across the line. And if they made accommodations for Isabel to go to the inclusion classroom 2 hours a week, if they're going to have to do that for the other 8 kids in special ed, or however, how many of them goes to inclusion classes as well, there would be a lot of kids just going around the school. So we decided to go virtual these 9 weeks, because the way they have it is you can decide after the 9 weeks, you can decide again if she goes back to school or if she stays at home. But deciding to keep her at home, now they are telling us of all these rules that we have to follow. Like she has to go online every morning at 8 a.m. or 8:30 to be part of these of the class that the teacher is going to be doing in the classroom, and it's going to count as attendance. So she has to be every day from Monday through Friday. And of course, that's not going to work with Isabel. Doesn't do very good with doing online stuff. So when we try to do therapies online, through the teletherapies, we had to cancel the ones that we had during the summer, the other therapies, because she just didn't do well. And so we have started to think about doing homeschooling just because of that, because it would be very hard for her to comply with all those requirements of her being online or listening to a classroom every morning through the computer.
Right.
But now that you say that if we take her out of school and do homeschool, then when she goes back, they're going to have to evaluate her again and do all that testing again for next year. That's going to be a headache. So I'm wondering if it is possible for us to meet with the teacher and then maybe agree on a curriculum that maybe we can work at home and they can pull their objectives from what we are working on at home. Would that be something that—
Probably not. And the reason is, let me tell you, because the reason that it's interesting that that Grapevine is saying we're not going to do anything live, and we're not going to do this, we're not going to do that, because schools are paid by attendance. That's how we get our money. And so average daily attendance. So the kids, if half the kids don't come to school or half the kids aren't logged in, that's a huge hit to the school district. Okay.
Well, what they're saying in our district is that the asynchronous piece, that he did stress, though, that the teachers will require that you have the assignment each day turned in. You have to still check in. What that looks like, I have no idea at this juncture, because I don't think they've gotten that specific yet. But to answer your question, and actually even going back to what Ruth is saying, you're still checking in. It's just that you're doing it specific to whatever the requirement is. But he did say that that's, otherwise there's no funding, right? If you're not doing like what Ruth's just
right. But playing the devil's advocate, and that's something that we've talked about. I mean, I knew of students, and these were high school students, not with special ed, but with high school students, and guys were working and paying their girlfriends to do their work and turn their work in. So they got full credit. They weren't doing anything, So there are ways around what you're talking about, and kids are pretty smart, and so if there's no live check-in, I would, of course the state's not going to know that, and TEA is not going to question it, but just from an ethical and moral standpoint, I have a problem with that personally.
Yeah, no, I think in our district anyways, they are going to be doing check-in. It's live check-in.
Okay.
Okay. Not live instructions.
Okay.
So you're checking in at X whatever time the teacher says for that subject, right?
Okay. So Ruth, yours though have to be in that whole 5 hours. Is that right?
How is that?
So your child Isabel has to be in she has to check in at 8 or 8:30 and be on all morning.
Oh, you see, I haven't asked that.
Okay.
I don't know. I'm assuming they're not going to want her online for 5 hours. I mean, that
Right.
would just be
So it may
too
just
much.
be,
I'm guessing probably it's going to be less than that.
it may just be a simple check-in, as Heidi's saying, and if that's the
Okay.
case, because typically most of the schools, you know, they take attendance at a certain hour of the day, and that's how they turn in. So you know, I mean, a kid comes into school, you know, as an administrator, kids used to come into school and your parents had a long vacation plan for the long weekend. They came to school till 10 a.m. because that's when we took attendance, and then they left for the rest of the day, but they were still they weren't counted as absent. So that's probably how they're going to look at it. There's going to be a specific time that Isabel would need to check in. And then, so that would be something to ask.
Okay.
You know, is she going to get all of her instruction virtually, and is it live, real time, which I doubt, or is it, you know, just a certain time it's live, or, you know, whatever. You'll need, that's just going to be something. And again, that's going to be district to district. It depends on the administration and the school board. Does that make sense?
Yes. Yes, thank you.
I do think the inclusion piece is going to be tricky though for everyone.
I think, yeah, you know, and I hadn't thought of that. I'm gonna email Marath about that, because I hadn't thought about that. But I mean, that is an IEP. That is part of their IEP. So at this point, as it stands, that's how they'd have to do it. But yeah. So if they're opening, they would, you know, I'd kind of just dismissed it because it's not opening. But I forgot about where you guys were now, Ruth. But if they open, I mean, then our committees are going to have to do that. But there are ways to do it, and the schools aren't going to want to mess with it. They're going to say there's too big of a risk. But I'm going to email Marath about that, because I think that's something that we need to have a heads up on. We need to find out what's the ruling going to be from TEA, because and really the school board. I'm going to check our school, because I don't think we've talked about that. Really, I mean, I'm just assuming that, you know, it's in their IEP, and it should, you know, because that's what it clearly says. Feds say doesn't really matter. They still have to follow their IEP. But I'll reach out to Heather too at NDSC, our lawyer, and see what she thinks. So I'll find out, and I'll get back to Heather so she can let us know. She can let y'all know.
I think it brings up an interesting question too along that lines, like if they're having to meet the IEP for like the goals and following from an inclusion perspective, those that are 100% virtual right now in Tarrant County, making sure that is the instruction. And I don't know that this, because I guess if it's written in your IEP, I mean, if you're fully included in, let's say, science, that you're not getting science delivered from virtually from your special ed teacher, you're getting it delivered from with the rest of the class, right? I mean, that would be the same thing, right?
Right.
So the conflict and the overlap, those where I see it being interesting, because you maybe have different grades the SPED teachers working with, and
yeah, the inclusion piece for virtual shouldn't be that hard, except for scheduling. And that's not your problem. That's, you know, that's the school's problem, the individual school's problem.
That brings up another question though. So if you have para support, I mean, should we be getting other support like remote, like if a para is technically already assigned to support in the?
I would ask. That's going to be a local school board decision.
Okay.
I mean, everything, you know, honestly, the big pieces that I talked about earlier, those are, you know, as I said, the federal and state laws, but the big pieces, all these little pieces, which are not really little because they're important for our kids, but with how are the parents going to be, how are they going to be handled? What are their responsibilities going to be? I mean, you know, yeah, I mean, I'm still we're waiting as a school, but we have a board meeting on Monday, and we're waiting. We don't have all our we normally have all our documents by today, and he said it was probably going to be Thursday before he had everything ready for us to look at, because it's just there's so much change and so many things they're having to consider at this point.
Is there any other questions? You did a
Concern.
great job, Marilyn.
Huh?
I said you did a really good job.
I don't know. I mean, there's just, I feel like I'm just like, well, I don't know. I mean, there's just so many unknowns, but you know, really the biggest pieces at this point, and really I would encourage you, because I'm calling in for the phone call next week, the webinar next week for NDSC, because we've got two attorneys on that call, and they're doing some investigating right now, and I'm going to shoot them an email about that just to see what they, about that. What about the inclusion piece? And because, like I said, it's very clear in the federal laws and TEA laws. So I can't imagine. But as I think about that, that is going to be problematic. So how are they going to meet it? And you don't want to lose that, because then we all know what happens. So I'd be more inclined to say, okay, well then I'll just have full inclusion until that time that I can have, I would go, instead of being self-contained, I would say, well, then I want full inclusion for the whole time until time to, but that's me, that's me.
Yeah, I asked them that, and I said, well, then I want her in the inclusion classroom, and then maybe someone can come and teach her whatever she needs to do in special ed. And they said that wouldn't be possible, because then she would be attending other classes that she is not at her level, and they couldn't have an aide just with her all the time.
Yeah, that's the most restrictive environment, but they can't, she cannot not be included because she's not on their level. That is an absolute against the law.
Okay.
So that is against the law. That is very clear in IDEA. A child cannot be secluded because they can't keep up. That they can't do that. They try, but they can't. Literally, they cannot do that. I'd love for them to say that and on tape. It'd be great. Sorry. I'd love to get that on tape. That'd be really good.
Yeah, we literally had, I think it was like M's like third grade art, and we were arguing about her going into like reading or whatever, and they said that exact same thing to me, like she's not at their level. I'm like, what are we doing in third grade that Emily can't participate in? They're like, oh, they're analyzing poetry. I was like, no, they're not. They are not analyzing poetry in third grade. I mean, yeah, I wish I had recorded that. I didn't know that they couldn't just say that to me, that was the reason that she couldn't go into the reading.
Yeah, well, that's the typical reason. And you have to weigh it all, what's best for, it's really more about what's best for Emily, or what's best for the child, and so there's always that thing of weighing, what's the best place, where's she going to get, what do you want for Emily? Are you wanting a lot of socialization, you're wanting her to learn, you're wanting a combination, so where can she benefit? But I maintain that they can benefit by getting the main objective in a regular classroom, and then if they need pull out for reinforcement and continual learning with reading and writing and all those things, and math, because our kids they don't get it. It's hard for them. Then that's fine. But to use that, which is what they always do, age-old excuse. And I'm going to just put this little plug in. I mean, some of your kids are getting up there into high school, middle school, and high school, and do not you call me immediately if they say, well, your child's reached a plateau and they really are not going to learn anything else, because that is not true. But I've heard educators say that. So you just call me, and we will call an ARD tomorrow. Because that is, yeah. I mean, my Jenny is 39 years old and she's still learning, so that is a major, that will send me to the moon. Our kids have lots and lots and lots of potential, and they shouldn't be told they can't. So, you see your kids, you know what they can do.
Did anyone else have any more questions? No? I think we're good.
So Ruth, I'm going to find out about that question. I'm going to find out about the inclusion piece. I'm going to find out, what was the other thing? Inclusion. And Heidi, what was the other thing you asked me about? I didn't write it down, so that's my bad. The inclusionary piece, because Ileana had a question.
Maybe evaluating. I
Oh,
don't know.
evaluating. Yeah, well, Marath has pretty much made that clear, but I can ask him about that.
But how is that clear if you're if everybody's well for the counties that are?
I know.
I mean, I don't understand.
I don't think I understand it, or none of us understand at this point. That's still a question.
I think the other question was about para support.
Oh, para support, right. Oh, thank you. Okay. Okay, I'm putting it in right now on my phone, para support. So para support and the inclusion piece, how are they going to do that? And what kind of recourse do we have if they try to pull that? Because that's what they're going to do. They're going to have art committees, and they're going to say, we can't do this for the safety of all the students, yada, yada, yada. But like I said, then I would say, well, then they can just go to full inclusion until time to go back. But
How do you think they might handle that with the teacher moving around for the inclusion part? Because a lot of times it's the same teacher goes in different classrooms for inclusion. What do you think they'd say about that?
I don't know. I just don't know. You know, there's this whole COVID. I mean, you know, it's hard to predict. This whole COVID thing is just so crazy, and and unfortunately, I mean, it. You know, so I'm not trying to minimize it at all. In fact, another school, some school people called me and said, "What do you think?" I said, "I don't think you should open right now. I really don't. I don't know if they will or not, but I said just because, you know, because of our kids, you know." And so if you read that information from the medical community, you know, for our kids, I just don't think it's a good idea right now. So, but that's like I said, that's my personal. If I had a child with Down syndrome, I'd say, no, we're not going to school right now. We're going to just do whatever we have to do until we can, as hard as it will be and as stressful as it will be, I just don't want to take that chance. So, because it's not, I'm going to protect, you know, I'm protecting my child. I'm protecting Jenny. You know, we don't really take her many places, and she's masking up when we go somewhere, and she's got hand sanitizer around her neck almost. But I wouldn't want her to go to school right now because somebody in that high school or middle school or elementary, some people are not social distancing. They're just not. And so, you know, I mean, we were at a graduation party for my niece, and we hadn't been anywhere for 2 months, really. I was about to climb the walls, and we had been nowhere, but it was my niece's graduation party, and we knew everybody that was going to be there, but we didn't realize that she was going to have, like, you know, what should have known. It was mostly family, but she had about 10 of her girlfriends and guy friends, you know, her close friends for graduation, for a party. And it was outside, so it was social distancing. It was outside. Everybody wore a mask, blah, blah, blah. But after that party, 3 days later, one of the students, she worked at one of the restaurants nearby, Boo Ray's, and Boo Ray's wanted everybody tested before they opened. And she was at that party, and she tested positive. She was asymptomatic. I mean, you'd never know. But then we all had to get tested, and then we all had to, you know, quarantine, and we all had. So I mean, it's inevitable. I mean, I think it's inevitable. It's going to happen until those numbers go down. And so when those numbers go down, then I think it's going to be okay for our kids to go back to school. And hopefully that's where it'll be. And I think that's what the county is hoping for. They're hoping that people, now that they've made masks mandatory, although I was at the doctor's office today, and there were people coming in, and they made them put a mask on, but they didn't have a mask on outside. You know, they didn't have a mask coming in. But now that they've made masks mandatory, and, you know, school isn't going to open, I mean, I'm hopeful that, you know, in 60, 70, well, it'll be about almost 75 days. So 75 days, it will be, you know, the numbers will be a lot lower, and our kids won't be at so much risk. But even then, I think that, you know, it'll be important to to still be asking those questions, and it'll be important to make sure that there's, you know, what are the protocols and what's going to happen if somebody is, if there is a confirmed case of COVID in the classroom or or even in the school, you know. There's going to be a lot of things like that that are going to have to be looked at, not just for our kids, but for all kids, but especially with our kids. So, anyway, I wish I had a crystal ball. Yeah.
I guess when you find out that extra the information, can
Yes.
you mind just sharing? Or I mean, if we want, we can schedule another an updated Zoom. We could do that, or however.
However you guys want to do it.
Or if you want to pass on to me.
I'll-
I mean, yeah.
Pass on the information to you. I can, you know, I'll send a note to Marath and to the NDSC people, and I'll look at our board policy, see what we've done, if we have done anything. I don't know that we have, because I don't remember seeing that. But I'll look at all that, and then I'll get an answer to you in the next few days, or by next week. Definitely before Isabel has to go to school, I'll try to get that information. And then, yeah, and then if we need to do something else, but I would say after the call next Tuesday, because I'm gonna listen into that whole call.
Yeah.
And see if I can glean any other information, because it'll have some information and then a Q&A as well. So, but I'll get the answers to those two questions for sure. And if there's something else between now and then, you know, if you don't have my contact, I mean, I'm on Facebook, so send me a private message, and I can add those questions to or send them to Heather and she can forward them to me or whatever.
Yeah, we can do it that way.
You know.
All right. Well, thank you, Marilyn, for coming on and putting that together for us. And thank you to everyone for logging on tonight. Appreciate you guys being here. And then again, this is recorded, so you can go back and rewatch it. And then if you have any questions, you can email me and I can pass those along to Marilyn. I know some people have her contact information, but if you don't, feel free to contact me. I'll get those questions to her, and then she can ask, and I'll get those back to you.
Yeah, and I'm happy to, you know, because I do have, not that you don't all too, I mean, everybody does, but I mean, being on the board of the NDSC, I have a lot of contacts with the medical field and the and attorneys and you know, a lot of people that, you know, like I emailed Heather today and just said, hey, your presentation next week, got it ready yet? Because I wanted to pull some stuff from it. She said, no, we don't have it all done, but here, let me send you my basic information I want them to know. So, you know, that was helpful to me. So I can get a pretty quick I should get a pretty quick response for these two questions as well. But I'm happy to there's no question that's too silly, or I think that you just, if you've got something on your mind, you know, holler and I'll see if I can find out. I may not always get the answer, but I can certainly try. So don't mind asking my resources, but we all do, right? Main thing is just stay safe, wear a mask, social distance, my friends, so that we can get back to normal.
Alrighty. All right, guys. Well, so we'll go ahead and end. And so, Marilyn, I just need you to let me have my Zoom back.
How do I do that?
Thank you.
Thank you. Thank you, Marilyn. Thank you,
Thank
Heather.
you so much.
Thank you very much. Appreciate it.
Thank you.
Heather, how do I give it back?
Bye, ladies.
Bye. See
Bye.
you soon.
See ya. Thank you.
Okay, so I really don't see it anywhere.
I don't know. It's fine. It's fine.
Maybe it's security? No.
No, it's fine. You know what? Go ahead on the bottom and just hit end meeting.
All right, love. Talk to you later. Give Emily a big hug.
I will. Thank you so much. Bye.